We're continuing our series on chronic rhinosinusitis with nasal polyps by focusing on how it's diagnosed. If you're living with long-lasting congestion or loss of smell, this episode explains what key signs to watch for, the tests doctors use, and what happens during a sinus exam. This podcast is made in partnership with the Allergy and Asthma Network. We want to thank Sanofi for sponsoring today's episode. While they support the show, all opinions are our own and sponsorship doesn't influence our content or editorial decisions. Any mentions of brands is for informational purposes only and not an endorsement. Now let's get to it. You're listening to The Itch, a podcast exploring all things allergy, asthma, and immunology.
So today we are covering how to diagnose chronic rhinosinusitis with nasal polyps with Dr. Farmer, who is located in Ohio, but I met her through Instagram. And she is Dr. Knows Best, which is the best Instagram handle, I think, ever for an ear, nose, and throat specialist. So do you mind introducing yourself for everyone?
Yes, absolutely. So I'm Dr. Tonya Farmer. I am a board certified otolaryngologist, head and neck surgeon, or ENT for short. I've been practicing in private practice for 24, going on 25 years now. I am a comprehensive otolaryngologist, so that means I see all sorts of ear, nose, and throat conditions. I'm not specifically specialized in one subspecialty of our field, but my practice is very heavy on head and neck and rhinology, sinus and allergy diseases. And I also see a lot of thyroid disease as well. I also see kids, so I do adults and kids. So that's primarily what I do.
Amazing. Well, welcome to the Itch podcast. We're very excited to get to chat with you. Today, we're going to be talking about chronic rhinosinusitis with nasal polyps, and we're going to be talking about how this gets diagnosed. But before we really launch into it, we would love to know if you could give us like a quickie overview of what chronic rhinosinusitis with nasal polyps is.
Right. So chronic sinusitis is really, it's just an inflammation of the sinus passages and the nasal cavity. So itis, we know, always just means inflammation. Whatever it's behind is inflammation of that. So rhinitis, rhino is the nose, and sinus, the sinuses. So it's a chronic inflammation of the mucosal lining within the sinus and within the nasal passages. And we put the term chronic in front of it because it has to do with the duration of that inflammation. Pretty much our cutoff is 12 weeks. So 3 months of chronic inflammation in the nose and sinuses, and we consider that chronic rhinosinusitis. So you can have chronic rhinosinusitis with or without polyps. With the polyps, it's because that mucous membrane, I always say it's kind of like the inflammation rubbed it the wrong way. That's how I explain it to patients. So you get this swelling of the mucous lining and you start to get these inflammatory swellings, and that's what polyps are. So you can have chronic rhinosinusitis without polyps, and then you can also have it with the formation of polyps because the mucous membrane has become so irritated and swollen that it forms these sacs of swollen tissue, and that's what the polyps are.
Great. Thank you so much. We actually have an entire episode dedicated to exactly what it is. So if you want more information, you can definitely tune in on that. And we advise you to do that because it's helpful to really know what it is before we talk about how to diagnose it. So now that we know generally what it is, what are the common signs or symptoms that might make someone suspect that they have this condition?
So some common signs and symptoms that I see in patients that come in that make them suspect, their doctor suspect, or even me suspect that they have chronic sinusitis with polyps are they'll have a chronic nasal congestion or blockage that just usually doesn't go away. You know, it's throughout the day and it doesn't matter the time of year. It's usually constant. They can also have a drainage with that, and that drainage can come out the front of the nose. They can oftentimes feel it dripping down the back or that post-nasal drip. You can also have facial pressure that's going on. And one symptom that patients have that kind of is like a big red flag is that they may have chronic sinusitis with polyps, is that their sense of smell is down. So either they don't smell as well as they used to, or their sense of smell has completely gone away. Some patients will also complain of headaches, and to a lesser extent, but I've seen this also, is they'll have some changes in their vision or pressure in their eyes, and it's just because of the location of the sinuses, and it may have to do with the severity of the polyps that they have.
And do you think that's gotten confusing with COVID? Because a lot of people during that entire pandemic period were really worried about sense of smell. Do you think that that's caused a lot of confusion? I'm sure you saw that.
So it can be, but if we remember the definition of chronic sinusitis with polyps, that's usually a long term thing that people are experiencing. Whereas COVID, you're going to get that infection as an acute viral infection. You have acute symptoms, you have an acute loss of sense of smell. And most people who lost their sense of smell because of COVID actually regained it. Now, there are some patients, of course, who don't. They have long COVID or that nerve never recovers after that insult from the COVID virus. But yeah, sometimes there can be a difficulty in distinguishing between the two. But for me, it's a matter of that history, going back to the history, going back to the duration of those symptoms. And then when you add some other symptoms with the physical exam, which we'll probably get to talk about, but when you add up all of those other things, that really helps distinguish that symptom of losing your sense of smell, or anosmia, it's called, whether it's related to chronic rhinosinusitis with polyps or to COVID, loss of sense of smell. But you can even say a viral cold, because people who have a viral cold even can lose their sense of smell. So there is that differential diagnosis, and that's where the history and the physical exam are very important in distinguishing between those conditions.
And so, can you talk about how you start that diagnostic process? So, what are the physical exam findings that you're looking for?
So when a patient comes in to see me and we're concerned, or their doctor sends them because they've had ongoing symptoms, it really starts with the history. That's what it starts with. So it's asking the patient, what types of symptoms are you having? That's what I usually start with. Tell me your symptoms. Are you having nasal congestion? Are you having drainage? Are you having facial pressure? And sometimes the patient can run their list because they've been dealing with this for so long that they can tell you boom, 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 exactly what their symptoms are. And also, it is me as the physician, as the specialist, asking those questions because I know what to ask for. So asking what the symptoms are, and then asking what the duration of those symptoms are, because that's going to help distinguish between different conditions. Could this be chronic rhinosinusitis? Could this be a COVID infection or a cold or even allergies? So asking the duration of those symptoms, asking, are there any triggers? Are there certain things that flare up those symptoms that might make you think more maybe allergy, if there's certain specific things that are triggering it, and maybe not having symptoms in between. I ask about the allergy history as well. Do you know if you have a history of environmental allergies? Have you ever been tested for allergies? Because we know that allergies is one of the most common underlying reasons for chronic rhinosinusitis. I also ask about environmental exposures, because that is something that's really important that can affect what's going on inside your nose or sinuses. So do you work in a factory? Do you work around a lot of chemicals? Do you work in an environment where you're exposed to certain elements? Are you a smoker? Could that be it? And I'm also asking, what types of treatments have you already done? Because think about it, by the time someone comes and sees a specialist, their primary care doctor has already tried A, B, C, and XYZ. The majority of the time. There are some times that I get patients that they haven't really tried anything. They just sucked it up buttercup and they dealt with the symptoms, but they got to the point where enough is enough. So they want to come and see a specialist. But the majority of the time, they've already tried numerous things like nasal steroid sprays or antihistamines, every over-the-counter sinus-related medicine they've probably tried. So I'm asking that. Or even antibiotics. Has their PCP had them on antibiotics already? And how many times? Oral steroids, have you been on that? All of these questions I'm asking about what things you've already tried, because does it matter for me to throw you another antibiotic or just say, try this other spray when they've already tried everything else? That's going to help my decision-making process. What's the next step that I make? And not only what have you tried, but did anything work? Did any of those things really help your symptoms, or did they not help your symptoms? The other thing that helps me, there's one type of nasal spray called Afrin, which is a decongestant spray. So if I have patients who are coming in and I know that that's a medication that they're taking long-term or on a daily basis, we know that long-term use of that type of nasal spray can cause a rebound congestion. Sometimes those symptoms that the patient is having may be related to that alone and not necessarily necessarily polyps. So that's going to be important in my history taking. And then once I take that history, next I'm going to go into my physical exam. And as an ear, nose, and throat doctor, I start with the ears. I do. And so I'm looking in the ears because we do know that when you have problems with your nose and sinuses, it can affect your ears. Everything's connected. So that's part of my exam. So I'm looking in your ears, I'm looking in your nose, I'm looking in your mouth. And one of the important components of my nasal exam is I look before I do anything to the nose, meaning I don't put any type of sprays in the nose or anything to prepare the nose. I want to see what it looks like with nothing in it. What does your nose look like? An anterior rhinoscopy just with my nasal speculum. And then I'm usually decongesting the nose so that I can get a better look into the nasal cavity with a scope. So doing an endoscopy, a nasal endoscopy, is a very important part of my examination as an ear, nose, and throat. So I'm using a scope which can either be a thin, rigid, stiff type of scope, or one that is flexible that I can use in the nose. And what the nose looks like kind of helps me determine which I'm going to use. If a patient has a deviated septum on the initial examination, which the septum is the divider wall in the middle of the nose, and it can be crooked to one side or the other, that's what we call a deviated septum, it can make it difficult to access into the nasal cavity. So in that case, I may want to use a flexible scope to get around the deviation versus a rigid scope. But regardless, I'm using a scope to look inside the nasal passages all the way to the back of the throat to determine whether there's mucus coming out of the sinuses. Is there any inflammation or congestion of the mucous membranes? And do I actually see gross polyps coming out of the sinus passages? Because that's going to help me determine the severity of the polyp load that this patient has. So that's usually the main process. And then, of course, a neck examination, et cetera. But that nasal endoscopy is one of the most important parts of my examination as an ENT.
Thank you for sharing what you do as an ENT. I would be curious, Dr. G, does this look similar for allergists?
Yeah, so when we see patients, we're usually what we call in the medical field co-managing patients, which means that I'm seeing the patient as well as Dr. Farmer. And so we each individually do different things. As you mentioned, Kortney, we do. So I will be able to do a superficial nasal exam. Most allergists do not do the endoscopy. Some do the nasal rhinoscopy, but most allergists don't. Usually we're just looking at it superficially. And so what Dr. Farmer mentioned with the nasal polyps just kind of falling out of the nose, some patients, it's really obvious. I mean, they will come in and say, something's coming out of my nose, right? But those patients are obviously more severe than most patients where the nasal polyps, which are those extra gelatinous tissues, will actually be further in where only Dr. Farmer by doing that exam, we'll be able to see those. And so for me, I'm focused on many of the things that Dr. Farmer is focused on, like the history, figuring out how long this has been going on, have they been allergy tested or not? Because the other thing that we know with allergies is that they can make nasal polyps worse. So they can worsen this condition. So you can have both conditions. So you can have chronic rhinosinusitis with nasal polyps and then also have environmental allergies, like you're allergic to your cat or dog or pollens, and then that can make the inflammation worse in the sinus passages and make those polyps get more irritated and grow more often. That's also important, is knowing their allergy history and seeing if we can co-manage those together. And maybe I can put the patient on allergy shots and help reduce that irritation that is caused by allergies from that allergic history too. But definitely the poor smell is something that also triggers me to think that something else is going on. And this isn't just classic allergies, that we probably have some other thing that's affecting their nasal passages, because just allergies alone usually do not cause poor smell.
What about asthma? Do you check about asthma history?
Asthma is also something that we look for because, as we mentioned during Dr. Katiel's episode, there is something called aspirin sensitivity or aspirin exacerbated respiratory disease that can also be associated with CRS with nasal polyps. So there are a lot of conditions that can overlap with this condition. And so it's important to keep all of those things in mind because sometimes treating one condition can help another condition too. We can use the same medication sometimes for the treatment of our patients and help them in multiple ways.
I agree. I think knowing their asthma history is important, especially if I think this patient might have polyps, then that kind of starts in the back of my head, raise the flag like, oh, maybe this is a patient with Samter's triad or the AERD. So asking about their asthma history and if they're aspirin sensitive, if they have allergy to aspirin products, that's going to be important to me as an ear, nose, and throat doctor because patients who have that triad, and that triad is they have asthma, they have aspirin sensitivity, and they have polyps. So asthma, aspirin sensitivity, and polyps. That triad for me as an ear, nose, and throat doctor, that's when I go, oh, because those patients are really difficult to manage when it comes to their nasal polyps. These are patients, because I'm a surgeon, I'm looking at them as this is a patient that likely is going to require surgery because their polyp disease is going to be more difficult to manage. So for me as an ear, nose, and throat surgeon, that history is important if I think they have polyps.
Absolutely. And if they do have that AERD or Samter's triad, then we usually also desensitize them to aspirin. And that's an entire episode itself that we don't need to get into, but we would desensitize them to aspirin. They would be on aspirin regularly in order to also help their disease as a part of the treatment for their disease. But again, hopefully we can do another episode focused on Samter's triad. But for this condition, yes, they can go hand in hand and it can make things more complicated and something that we need to understand so that we do effectively manage the patient.
What I'm always hearing when it comes to like the diagnosis process is history is key, right? So a really good medical history is very important. And for us patients, it's always helpful when we come prepared. So before you go to your appointment, know what medications you're taking, write down all of the medical conditions you have, especially if it's a new doctor, and then you're prepared to go in and have that conversation. Honestly, I have a very embarrassing thing to say, but I used to forget to tell my doctors I had asthma. So I have to write these things down because sometimes you can get really overwhelmed, and asthma is a huge part of my life, and sometimes it just gets completely forgotten. So write down your history to bring that with your doctor. And then there's the physical exam, and that includes looking up the nose. And I remember that we talked about the sinuses also being not just the nose, but part of the cheeks. And can your endoscopy look all the way up into that area, or is there something else that you would do with patients to see?
So the limitation that you have with nasal endoscopy is that you can't look directly into the sinus passage unless you're dealing with a patient who has already had endoscopic sinus surgery that actually opens and widens the sinus passages. That's the purpose of doing sinus surgery. So unless you have that type of patient that you're doing a nasal endoscopy on, you can't look directly. You can look inside the nasal cavity. The anatomy is that there's openings along the side walls inside the nose, in between these structures called turbinates. But that's how our sinuses are these empty cavities that sit all around our face. We have them in our forehead, in between our eyes, and into our cheeks. And then there's another one kind of in the center of our head. But those sinus cavities, you can't take your scope and actually stick it in the sinus. Again, unless it's been artificially opened from sinus surgery. In order to actually look into the sinus passages, then I would order a CT scan. I would recommend that. And especially in a patient who has polyps on physical examination. So if I'm seeing polyps on a nasal endoscopy, that's a patient that I'm typically sending for a CT scan. Because guess what? The polyps that I'm seeing coming out into the nasal cavity, that might just be the tip of the iceberg. I may just be seeing what's here, but I don't see the component that's within the sinus cavity. And that's where the polyps actually originated. So doing the CT scan, that is a special x-ray that is going to show me detailed anatomy within the sinus passages. So I can see, are the polyps just right here entering into the nasal cavity? Is it completely filling the sinuses? Is it just only partially already filling the sinus passages? Is it causing disruption of the anatomy inside the sinuses? Or is there something that might even look like fungus, which is another type of infection that you can have? Or is there a tumor? While that is less likely, that's another condition that there might be some overlapping symptoms. So getting that CT scan is a very important test when you're trying to look at the diagnosis of chronic sinusitis. That's the objective evidence that we have. In addition to seeing the polyps inside the nose, the CT scan is going to show us the severity, the degree of inflammation of the mucous membranes within the sinus passages. And typically, sometimes I think, man, I order a lot of CT scans, but then I have to remember I'm a specialist, right? So by the time the patient gets to me, they've already had everything else done. They've already had antibiotics multiple times or oral steroids multiple times. So we're at that point in their journey that it's time to get some diagnostic studies like a CT scan. So that would be the next test that I would order for the patient.
Yeah, and it can help guide management. Is that correct? It can help you figure out what next steps might look like for you.
Yep, it can absolutely help me in that decision of how to manage. So once I get the CT scan, I'm bringing the patient back into the office and I review those scans with the patient so they can see and understand exactly what I'm seeing and what I'm talking about. For me, I think it's very important that if the patient understands, if the patient sees it themselves, then they'll be like, oh, wow, okay, this makes sense to me. So I go over that CT scan, and based on those findings, we'll determine, is this something that we can manage medically? Maybe making some changes in the medications that they might be on now, or try something new like a biologic medication, which is an injectable medication? Or is this a patient that, because of the severity of the disease, the polyp load, medications just aren't going to manage this well, that this is a patient that's going to need sinus surgery? So that's the next step in their management that we're going to do. So that CT scan is really important in, number one, confirming the diagnosis. Number two, helping to determine what the severity of disease is, that polyp load. And number three, what other types of medications or what's the management that we're going to take moving forward, whether it be medical or whether it be surgical.
Thank you for discussing the diagnostic procedures and the CT scan. They're both super important and helpful in making this diagnosis. And as a part of the workup for these patients, I mentioned that as an allergist, I definitely do allergy testing to see if dust mites or if animals or if pollen is playing a role and also causing more disease for these patients. But we also do tests looking at their eosinophil count, looking at the total IgE level, and those are both markers for type 2 inflammation that may be helpful in picking the right medication if we do end up going with a biologic. In addition, we might also look at their immune system. So if they're having frequent use of antibiotics, which a lot of patients with chronic sinusitis with nasal polyps are getting a lot of antibiotics, because when you have polyps, you can actually get infections of the sinuses because they're blocking the normal clearance of the fluid. So you can get infections. And so these patients are oftentimes on multiple antibiotics. And in order to make sure that there isn't something else going on, like their immune system isn't working the way that it needs to, as an allergist, I'm also an immunologist. And so we look at their immune system, we look at the immune cells, make sure that they have enough of those immune cells. In addition, we make sure that those immune cells are working the way that they should be. And so that's also something that might be a part of the journey as you're getting diagnosed with chronic rhinosinusitis with nasal polyps. Dr. Farmer, I know we had mentioned some of the things that can coincide with chronic sinusitis with nasal polyps, and sometimes the diagnostic pathway can be really long and challenging because I think people get into the cycle of getting treated with antibiotics, for example. Patients might be going to urgent care, emergency rooms when they feel like they have a sinus infection, and then they never make it to the ear, nose, and throat doctor or to the allergist in order to kind of break that cycle. So what are certain things things that patients need to remember when they're on this journey to get off of that cycle of just getting antibiotics and not getting to that final diagnosis?
So I think one of the most important things that I tell patients is it's very common to get a cold, right? The symptoms of a cold can overlap symptoms of chronic sinusitis, right? So the duration of those symptoms is really important. Going to your primary care doctor is going to be your first line treatment for this. But if you're going to your primary care doctor multiple times, you're getting those antibiotics numerous times, and you're still having problems, you really need to be proactive and intentional with your healthcare and ask your primary care doctor for a referral to an allergist or to an ENT doctor, because there could be something else going on, like a deviated septum or polyps, and that's the reason why you're not getting better. So I think it's really important for patients to have that voice of an advocate for themselves to say, hey, I'd like to see XYZ, another specialist, because there could be some other underlying condition like polyps, or that deviated septum. And that's the reason why they're not getting better. So if you're constantly sick, you're constantly on this medication, or you're trying a nasal spray, you're trying an antihistamine, you're trying medications over the counter, and they just are not relieving your symptoms, if you're not getting better with that within a 2-week period, then you should seek some medical care. I have patients who they just, like I said, suck it up, buttercup. They try to do things on their own. They're managing their symptoms on their own without going to their doctor. But if after 2 weeks you're really not getting better, you should go see your primary care doctor. That's your first line of defense. A viral cold, it's going to run its course within about 10 days. That's why I say if after 2 weeks it's not better, you go see your primary care doctor. Let your primary care doctor manage those symptoms. It's uncommon for me to get a patient who comes in with symptoms just of a few weeks and they haven't seen their primary care doctor. Most people are not jumping to a specialist. Most lay people understand you go to your primary care doctor. But if you do all of that, and for patient advocacy, if you don't feel that your primary care doctor is willing to refer you to a specialist, contact your insurance company and see whether you need a referral to go to a specialist. Ask your insurance company, who are the specialists, allergists or ENT specialists that are in my network that I can call and see. Not all specialists require a referral. I don't require a referral from another physician for the patient to be seen. Now, not all doctors are like that, and every facility is different, but a patient can just call my office and make an appointment without a referral. These are things that as a patient, you have to know that you have a voice and you have to be an advocate for yourself to help get you off of that this is just not working for me.
What I'm hearing is that there's a lot of things that can be happening. So you can have a chronic sinus infection, you can have environmental allergies, maybe you have both of them at the same time, maybe you actually have chronic rhinosinusitis with nasal polyps. And the two things that I've heard are big distinguishing factors are how long the condition is lasting. So are you continuously going back to get antibiotics because the sinus infection doesn't leave? And are you losing your sense of smell even when the environmental allergens aren't around, right? So I feel like what I'm hearing is that you can have these things. You can have environmental allergies. You can have a sinus infection maybe that time, but you may also have chronic rhinosinusitis with nasal polyps. And the things you want to look out for are timeline and the very big one, which is sense of smell. Sense of smell is what both doctors said are their big red flags. If this is consistent, it's time for you to seek care. And what I really loved hearing from you, Dr. Farmer, is that if you aren't getting the care you are looking for from your primary care, or it just feels like it's going on for too long, seek a referral to a specialist and talk to your insurance company about what that looks like for you, because maybe you don't necessarily need a referral. So if you feel like it's time for a next step, there are clear ways to do that. And it doesn't always mean you have to go back and back and back to your primary care physician. And why are we talking about why you want to see a specialist or get that referral? And it's because I think getting the proper diagnosis means that it's going to impact your management, right? So what does that look like, Dr. Farmer?
That is very important, seeking care in a timely manner. I know we were talking about 12 weeks or 3-month time period, but I want people to understand that's the duration for the definition of chronic, and what we're talking about is you can put that chronic on anything else, but we're specifically talking about chronic rhinosinusitis with polyps. But I want people to understand that you don't have to wait 3 months, before you seek care. You don't have to wait 3 months before you even see a specialist at all. So don't equate 3 months to, oh, I got to wait for 3 months at all. You shouldn't have to suffer for 3 months if nothing is working here. That's just our definition, okay, of chronic. So that's number one. But yes, waiting longer term, not getting the care that you need to, and just kind of, I use that term, suck it up, buttercup, but because you don't want to just continue to do that, because you can have disease process that is progressing all along. So that's going to, number one, make your symptoms worse. So you're feeling worse. It's also can make the management of it more difficult. So now the polyps, whereas they may have just been within the sinus passages, now they may have grown to the point that they're pushing out into the nasal cavity, or maybe they were just started here in the maxillary sinuses, but now they've grown and they've pushed into other sinus passages. So now that can make the manage of them more difficult. And if the decision is made to have surgery, it might mean that you need to have more extensive type of surgery, or it can get to that peak level that it's very difficult to reduce that load. Maybe had treatment been sought sooner, we could manage that load with medication, versus it got to the point where now they're so bulky that we just have to do surgery. So it could be a matter of having to prevent surgery versus having to go to surgery. Also, as the polyps progress, it can start to impinge on other things. I mentioned a little earlier that while it's less common, some patients can experience eye symptoms because our sinuses sit all around our eyes. Well, now the polyps might get to the point where it's really impacting the orbit or the eye, and it's worsening the symptoms, and now you're having to manage something else. So the longer you wait, yes, the more severe the diagnosis may be when it is finally made, and it can make it more difficult to manage those symptoms. And it might be the difference between medical management and surgical management because you waited so long to seek medical help.
Absolutely. And also the prevention of multiple antibiotics that are not helping, right? Because it's not related to infection, these symptoms. And then also unnecessary oral corticosteroids, which we're really trying to get away from because of all of the negative side effects. And then, we talk about this all the time, the quality of life. So your quality of life can be improved much quicker if we get to the right diagnosis. So thank you so much, Dr. Farmer, for taking the time to be on with us and giving us all of your helpful information. You're just such a good educator. And I knew that from Instagram, but it's nice to be able to talk to you about a specific topic and really get all of that knowledge today. So thank you. We'll have more conversations.
Thank you so much for having me. I enjoy this. I love education. I love educating the public about all things ear, nose, and throat. So thank you for having me.
Great. Thank you so much. We'll have links on how to find Dr. Knows Best. And finally, we'll link to our first episode in this series about what is chronic rhinosinusitis with nasal polyps. So thanks for listening.
Thank you for listening to today's episode. Remember that all information you hear today is for informational purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. And also, don't forget to subscribe to our podcast. And if you have a second, help spread the word by rating our podcast and sharing with your friends and family who might also be interested in learning more about allergies, asthma, and immunology. You can always stay up to date by checking out our Instagram, The Itch Podcast, where you can leave questions you are itching to know, or check out our website, which is www.itchpodcast.com, which contains more information about the subjects we covered in today's episode and every episode. Until next time, have a fabulous week.